Hello, welcome to today's session titled Respect, Inform, and Trust, Communication Strategies to Improve COVID-19 Vaccination Acceptance Among Older Adults. Before we get started, I would like to go over a few items so you all know how to participate in today's event. When you join today's webinar, you selected to either join by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane on your control panel. You will have the opportunity to submit text questions to today's presenters by typing your question into the questions pane on your control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce Emily Hinsey, Director of Operations and Program Development for Grant Makers in Aging, and moderator for today's webinar. Emily, go ahead.
Thank you, Ryan. Welcome, everyone, and thank you for joining us today. As Ryan said, my name is Emily Hinsey with Grant Makers in Aging. Grant Makers in Aging is a national membership organization of philanthropies, acting as a relevant and responsive network, resource, and champion, amplifying the voices of older people and issues of aging. I want to note that today I am standing in for our CEO, Lindsay Goldman, who is taking care of a family member with COVID. Such is life these days. She sends her regards and looks forward to being with us on the next webinar. Well, we are pleased today to be launching our new webinar series on COVID-19 vaccinations and older adults, presented in partnership with Generations United and the American Federation for Aging Research. We would like to thank the John A. Hartford Foundation for sponsoring this series. Today's conversation is focused around messaging, hesitancy, and trust around the COVID-19 vaccines, and will focus on different models for action. The first draws on a successful campaign by Generations United that tapped the power of intergenerational communication, interdependence, and responsibility to others in promoting the flu vaccine. The second is a new multi-partner campaign, the COVID-19 Vaccine Education and Equity Project, that seeks to address skepticism, build confidence in the vaccine, and address health inequities. And finally, we will hear about a grassroots volunteer effort in Denver, to help hundreds of older people sign up for vaccinations. So joining us today is Karen Jones, President and CEO of the Black Caucus and Center for Black Aging, an organization dedicated to the physical, economic, social, and financial well-being of low-income African-American older adults. Donna Butts is Executive Director of Generations United. Generations United works to improve the lives of children, youth, and older adults through intergenerational collaboration, public policies, and programs for the enduring benefit for all. And Melanie Valadez, a high school junior from Denver, who has helped hundreds of older neighbors sign up to get vaccinated at a drive-through clinic in her community. Welcome to you all. I want to remind the audience that you could submit your questions for our panelists at any time in the question box at the right-hand side of your screen. So Karen, we are starting with you to share more about the COVID-19 Vaccine Education and Equity Project.
Well, thank you so much, Emily, and hello, and it is my pleasure to be with you today to talk about the COVID-19 Vaccine Education and Equity Project. As Emily mentioned, I am President and CEO of the National Caucus and Center on Black Aging, NCBA. And so we are very proud to be a part of this COVID-19 Vaccine Education and Equity Project. Next slide, please. Last summer, in the beginnings of the virus spread and reports of the development of a vaccine, the Alliance for Aging Research, Healthy Women, and my organization, NCBA, we all convened to discuss how we could best address our individual communities with more information more facts about the virus itself and the proposed vaccine. As the convening, these are the convening organizations that you see there. Next slide, please. As the convening organizations got together, we got with a variety of partnerships and networks, and we've been able to engage over 175 organizations, which include patients, caregivers and their families, diverse communities, employers, healthcare workers, aging organizations, veteran groups, frontline workers, and we even have scientists. So these are just some of the logos of some of our stakeholders, but we have just been very pleased to work with so many groups and so many organizations that reach so many different communities. As you know, there was a lot of misinformation, and there still is, and fear. And any news of a vaccine was met and has been met with hesitancy and mistrust. I myself was not totally convinced that the vaccine could be developed at such a rapid pace. However, the community that I represent, which has a long history of mistrust in the healthcare system, I understood how important it was for our organization to engage in learning everything we could about the virus, about the vaccine, the clinical trial process, the regulatory review, and the distribution and access, questions that I knew we would be asked by our seniors and we needed to be able to answer. Next slide, please. So the COVID-19 Vaccine Education and Equity Project developed our core objectives to ensure that we had open dialogue, that we encouraged engagement and effective communications. Our major efforts were to provide education and ensure and advocate adherence to the gold standard in the regulatory process. We encouraged our partners to impact COVID-19 vaccinations. We're getting the message across that this was not just to protect themselves as individuals, but their families and the community at large. We have worked to raise awareness on how important getting vaccinated is for public health, for the economy, and for the broader society. And we have led the effort to equitable distribution and access. I encourage you to go to our website, which is covidvaccineproject.org, and learn about all our efforts that we've done over this year. We have several resources and materials that you can reference and hopefully share with your networks. Next slide, please. Those are some of our materials that you will see on our website, and we hope you will share them because they're very informative, and they've been developed in culturally competent ways. We have them in different languages, so please, we encourage you to go to our website and get this information. Next slide, please. Recently, we launched the Count Me In campaign. This is a nationwide digital campaign that provides individuals and organizations a chance to tell their story, to show off their vaccination photos, or just help build confidence and motivate others in getting the vaccination. So we encourage you, if you have had your vaccination or you're thinking about getting your vaccination, to join our Count Me In campaign. We want you to know that we truly believe in each one, teach one. And we know that that's most effective. Seeing someone and others who you know and who look like you and who you just believe as a trusted voice can encourage many, many more people to take advantage of the opportunity to get the vaccine. And to do so will empower them with information and confidence. Next slide, please. So these are ways that you can participate. We encourage you to, with your leadership, to share again your photos and your testimonies on our Count Me In campaign. And this is truly important so that you can be a voice for older people that you represent. We encourage you to download the Count Me In resource pack, where you'll find all kinds of information that you can use on your social media platforms. We want you to feature and highlight our Count Me In campaign on all your publications, newsletters, everything that you may send out to and share with your organizations. We hope you'll distribute information and our updates by keeping tabs on our website about the COVID-19 vaccination education and equity project on all your networks on a continuing basis. We want to amplify all of our bilingual materials that are online, and we want to promote all of these project webinars with vaccine experts, and you can invite any of us to participate on a webinar for your employees. We are available and ready to share all information and to help you in encouraging people to get vaccinated. And of course, we encourage you to follow us on Facebook and Instagram and all other social media. There we've listed our social media name, COVID Vax Project. And most importantly, we hope that you will join us in our Count Me In conversation by using the hashtag CountMeInCOVIDVax. So thank you very much for allowing me the opportunity to tell you about the COVID-19 Vaccination Education and Equity Project. We appreciate so much anything you can do, and please call upon us if we can be of assistance and help you in making sure that we address this public health issue. Thank you.
Thank you, Karen. Next, we will hear from Donna Butts.
Thank you, Karen, and thank you, Emily. I'd like to thank Grantmakers in Aging for allowing Generations United to be a part of this partnership on these webinars. And it's also great to be working with Karen and so many others on the Vaccine Awareness Project. But today, as I said on my next slide, what I get to do today is share with you a little bit about a campaign that Generations United launched in 2015 with the support of Pfizer that really focused on multiple generations and the importance of vaccinations across generations. On the next slide, the Generations United itself was founded over 30 years ago to really argue for a caring society, one that valued and engaged our bookend generations. So we can't look at anything without thinking about what the intergenerational solution is to that. And so on the next slide, when it came to this need to make sure that people were educated about vaccinations, we realized that so much of the work had been done in separate age groups. People were focused on what older adults needed, people were focused on what children needed, but what they weren't approaching it from was that aspect about it touches all of us across the lifespan, and that understanding the interdependence that a grandparent getting a vaccination helps a child, and a child getting vaccinated helps an older adult or a neighbor. That to bring that perspective, we really felt would be unique. And it was, and what we're pleased with is that we've seen so many other groups start to embrace that sort of lifespan approach to vaccinations, that we don't live isolated in those bubbles. So the next slide, what did we launch in 2005? We really wanted to get across that intergenerational interdependence message. And the one thing that we knew is that we're experts in intergenerational approaches, we're not experts in vaccinations. So it was really important for us, if we wanted to get across that unique intergenerational message, that we developed the strategic partnerships with people who knew a lot more deeply the subject content of what we were approaching. So we were fortunate to partner with the Gerontological Society of America and the American Academy of Pediatrics. So Generations United became the bridge between these two well-known, well-respected organizations that focus on bookends, and we tried to help bridge that effort between the generations. So we worked really closely on strategy, and what we did was really, because we had about 12 to 18 months, was to develop really compelling information to share and tools that people could use. So on the next slide, those campaign tools, and the next slide, we're really focused in a few ways. One is that we developed a website that I would encourage you all to check out called Bandage of Honor. And on that website are all of the materials that I'll be mentioning today. We created infographics to really show across the lifespan the importance of vaccinations and when they were important. We really know that for people to hear you, you also have to have fun. So we developed celebrity memes and engaging, what we thought was engaging content. And then we developed a discussion guide because, as you all know, having a discussion about vaccinations sometimes isn't really easy, even in the same family, let alone in other groups. So what we did was develop something a guide to really help with that, having a tough conversation across generations. And then we engaged a lot of media and different outlets. So I'm going to kind of quickly go through a couple of slides to show you what these look like. The next slide is a picture of what our Bandage of Honor website looks like. And the next slide is the infographic. And then the next one I'll stop at just for a moment, because you may have heard about this more and more with the COVID vaccine, is that Elvis has become a king again. And we were really very pleased that years ago we held him up as a vaccine king and somebody who really did make an impact across generations when he was willing to take his shot on the Ed Sullivan Show. But there were other celebrity spokespeople and quotes that we also grabbed and put into memes, like the next slide shows, whether it's a new father that Mark Zuckerberg was, or a skater, or the next slide, it might have been the President of the United States, and it might have been other celebrities. And we did, yes, we did do one with Lynnmanuel about nobody's going to take away my shot. So we had a good time. People really picked up on it and engaged in it. Then on the next slide, staying with our Elvis theme, I was blogging for the Huffington Post regularly at the time, and so I did a blog about Elvis as a vaccine champion. And the fun part of it was there were 17 references to his songs throughout that particular blog. So people had a great time trying to see if they could identify all the Elvis Presley songs. We did that, and on the next slide, we also were able to do a blog that was signed by the heads of the 3 organizations that were partnering on this to show the fact that this message was indeed important to all of us and to our members. So on the next slide, the vaccine discussion guide itself has really interesting, compelling content that you can share with a grandchild, with a grandparent, with an uncle, a neighbor, an aunt, and some of the stories that we use, some of you may be familiar with. One of them was about Balto. And if you remember him, he was the husky in Alaska that when they were trying to get the diphtheria vaccine from Anchorage to Nome so the children in Nome could be vaccinated, he was the lead dog that got his sled there first. And that became the Iditarod. So those kind of conversations that people can have about why it's important is really what we were trying to get across. So on the next slide, because it was a campaign, which means it was limited time and limited ability to go really deep, what we measured was our reach. And on the next slide, you'll see that we really were pretty successful in reaching a large audience of engaging people in social media, whether it was using our hashtag, whether it was sharing our memes, whether it was asking for heads of organizations to give us quotes that we could incorporate into the campaign. But we really did touch a number of people and a number of organizations throughout the campaign. And we continue to be involved in this work. I'll tell you a little bit about that in a moment. But on the next slide, we also were very fortunate to work with 2 partners in 2 countries. And on the next slide, those 2 countries were Japan and Spain. And what I really enjoyed about this is that they took the campaign that we developed here and they took the pieces that were relevant to their countries and their cultures. And it really made that stick and work where they lived and where they were. And I think that's something that's important for all of us, because there's such diversity in our country. It's what works and what is going to be communicated and what people are going to hear is what we need to be thinking about. So on the next slide, you'll see what Japan did, which I really loved. What they did was they took our infographic and they turned the vaccine into a ninja warrior. And they had a manga cartoon artist who created the lifespan and showed the vaccine protecting children, protecting older people, but fighting it off. They also used robots in facilities for older adults that would go around and show people what they needed to know about some of the latest vaccinations. And they did ads and they did interviews in neighborhood newspapers, because people still read or read neighborhood newspapers. Then in Spain, which is on the next slide, they took our materials, obviously, and translated them into Spanish, but they also felt like the guide was too dense, that people wouldn't read it. And so what they did was they broke the guide down into consumable modules, pieces that they could use in their community education efforts. They also did surveys of healthcare workers and provided education to healthcare workers about why this was important. So on the next slide, we were able also to do, with our partners and with other groups, to really reach, again, through publications, through presentations, reach a number of audiences with this message, so that that message about the interdependence of the generations, the importance of talking about vaccinations and realizing that vaccinations did impact all of us at every age and stage of life was important. So next slide, what we've been working on the last couple of years is making the content even more meaningful as we have been in the COVID pandemic. For us, of course, a lot of that relates to intergenerational programs where younger and older people then could not be in as close proximity, as well as multi-generational and grand families. So we developed infographics that really talked about the importance and making the case for why it was important that even as we're sheltering because of COVID, people remember to get their routine vaccinations. So on the next slide, we also were able to talk with a number of our grandparents and other relatives raising children, and in particular through our Grand Voices Network, which is made up of representatives from about 47 states and 12 tribes. And these are relative caregivers that we've worked with to help tell their story. But what I really value about them is that they tell us what we should be doing. So when we were talking to them about the vaccine project and what we were doing, what we sensed was a lot of initial hesitancy, and that's what they told us, was that they really weren't thinking that they were going to get vaccinated or encourage their friends to get vaccinated until they really saw others like them being vaccinated. Now, more recently, we've had conversations about greater acceptance and really understanding that the vaccines are safe and they need to make sure that they can get in a line and get access, because it's one of the big issues is how they can access the vaccines. So it really is also important that now our message is including the importance of returning to routine vaccinations, because that is one thing we've seen is as people have sheltered in place, the children in multi-generational families or grand families have not been getting their routine vaccinations. The older caregivers or the older heads of household haven't been, and we need to make sure that we're getting children and adults back on their regular vaccine calendars and schedules. So on the next slide, that's the focus of our work going forward, continuing to get the messages out there, but really to refresh our website, refresh the materials, and to promote the importance of routine vaccinations as well as access to the COVID vaccination in order for us to keep healthy intergenerational communities and households. So we'll be looking a lot at how we can make sure that we're engaging grand families and multi-generational households. But I wanted to leave you with one example that I thought was really impressive, because then you're going to be hearing from a young woman who I think is very impressive as well. There was a program that ran for 10 years in Central Texas. And what that program did was that it took or engaged older adults and educated them on how to educate others about the importance of vaccinations. And they placed them in healthcare organizations all across that area. as childhood vaccine champions. What they were able to do was educate young parents who may not have had to live through or have firsthand experience in surviving a devastating disease that was now vaccine preventable. So they had that time and that wisdom to be able to help young parents understand why it was important that their children get vaccinated and that they follow the schedule of regular vaccinations. They were able to reach over keep track of about 250,000 infants during that time. They enrolled their families, and they sent out reminders, booster reminders, to about 500,000. And they did it all, you'll love this, during a time when it was all on little index cards that they kept. But they had a tremendous impact. And one of the other impacts that I think is really important for us to remember when we think about this intergenerational approach is that the medical staff in those centers originally was very sort of like, it's just going to be a pain to have these people here. They're not going to be helpful. Who's going to listen to them? As soon as the program was really off and running, they realized the value that extra pair of hands, that wisdom, that knowledge, that skill, what that added to the patient experience. And they got so that they really valued, respected, and admired the contribution that the older adults were making. So when we think about combating ageism also, we need to make sure that we're engaging people in roles that show that people of all ages can be leaders. People of all ages have roles to play. And so now I'm really delighted to be able to turn it over to Melanie Valadez to tell you a little bit about her story. Thank you.
Thank you, Donna, so much. And we're getting Melanie to come on. There you are. Hi, Melanie. I'm so glad you could join us today. And you've been doing such incredible work these past few weeks. And so can you tell the audience a bit about your efforts and how you became involved?
Yeah, sure. So I originally became involved in trying to help distribute COVID vaccines through my parents and through their involvement with the church that we've been going to since I was like a little kid. They got into contact with basically the coordinator for setting up the areas where health workers would distribute vaccines, and her name is Linda Sosa. And she got in touch with my parents. My parents saw that she needed a lot more help, so they asked me to come in and try and help her out as best as I could with managing calls and managing the space and getting some volunteers to help out. So that's how I got involved, and I ended up taking a lot of time to try and help out, and it just kept going back. So I've been helping out with setting up those events, and we've been doing different rounds to get vaccines out to different people.
That's great. Do you have a number of how many people you've signed up?
I don't have an exact number. There's just so many people that we've been signing up. It's kind of hard to keep track. Linda Sosa probably has the numbers, or the hospitals and the health workers probably have those numbers.
That's okay.
It's in the thousands. That's yes, as much as I know.
Yes, it's a lot. So thank you, and it's incredible work. So, how have you learned, or what specific things have you learned from these efforts and from your experience these last few weeks?
I guess I've learned a lot more about communicating with people as a team, because I'm usually a pretty solo worker. So I've had to communicate with the volunteers. I've had to help situate them and be that a kind of point person for them if they have questions. It's taught me a lot about working with other people as a team and building more relationships with people my age and the adults who I am helping out as well.
Mm-hmm. Absolutely. So what are the strategies that you use when you call someone? Have you had any challenges that you can share?
The only challenge that we ever really got was when they wouldn't pick up because they might have thought we were spam calling them. Eventually, some of them would call us back since we left some voicemails talking about how we were part of San Cayetano, St. Cajetan's, I think that's how you pronounce it in English and that we were trying to get them signed up to get a COVID vaccine. I think that's the only main issue that we really had. And maybe a couple of times where someone was signed up on accident or like double booked on accident, so we just had to edit that. When we were doing calls, we would have a form that we would need to fill out with specific questions, so name, age, birthday, if someone could drive them to the site, stuff like that. Eventually we shortened it a bit more just so that we could call more people faster, since the original document had more questions like email, stuff like that.
That's great. And can you share a little bit about who in your community you're calling, and a little bit about the types of people that are coming to the clinic?
So for the clinic set up by the state, we were trying to call more people that were part of the church, so a lot more Hispanic people. Eventually they announced it on radio and television, so a lot more American people came. But for the second round that we did with just the church and National Jewish, we signed up people directly on forms through the church, so pretty much everyone that went was Hispanic or like of Hispanic heritage. So we signed up through calls or through direct writing them down on a piece of paper so that we could call them back later, or just set up the document where we could send them up for a schedule. Once they wrote down their name, we would give them their time, and then they would just have to show up.
And you can offer Spanish or English language on the phone when you're calling. Is that right?
Yeah, so I speak both Spanish and English. Originally, my mom was helping me out with like Spanish calls because she wanted to help out too, but since she didn't really know how the forms worked or how she could schedule people, I did the scheduling on the side. And then I would talk to English speakers and occasionally some Spanish speakers if she was like having a tough time writing down all the information on her notebook, because she would like to write down everyone we called so that if they didn't answer or if we couldn't sign them up, she could write them down and save them in her notebook for later if we ever did do other rounds. So she was doing that as I took some other calls.
That's great. And then I think the last question, Melanie, is, the audience is adults who are listening to you. So what are some things that they could learn from you about younger people helping older people?
I guess just don't underestimate like the things that we're capable of, because I remember I was doing an interview with someone and on their article they wrote that something like, well, other people Melanie's age were at home like on their phones doing stuff, she was helping out with his vaccines, but I don't think she realizes that I'm one of those kids who's at home like doing schoolwork and like playing games and or like drawing or something. So I'm doing this stuff because I want to, but that doesn't mean I'm not also like a normal kid. So I'm not some kind of special exception. If these opportunities are presented to students and like people my age, then I feel like a lot more would be able to use them to their advantage and to help out their community. But since they're not, a lot of the demographic is shown as people who don't do anything. But if those opportunities aren't presented to us, then we can't do anything. This came to me through my parents. I didn't know this was happening beforehand. And if they hadn't told me, I wouldn't be doing the things that I'm doing.
That's incredible. Well, I think you're exceptional, so thank you for all you're doing. But it's a good reminder that you need to be shown, and then once you can have the opportunity, that you're more than willing to help and can do some pretty incredible things. So thank you, Melanie, for all you're doing. So I want to now open the conversation up to questions from our audience, and if everyone could come back on the camera so we can see you. And I want to remind our audience that you can submit questions to anybody who you've heard from by typing those into the question box that's on the right-hand side of your screen. So I do have a few questions to get us started, and I'll ask them of each of you, but I also have some questions for all of you. So I will start with Donna. And I just am curious about the idea of an intergenerational approach and why you think this has been so effective when talking about the messaging and acceptance of vaccines.
I think there are a number of reasons, but two that stand out to me is that oftentimes when we're thinking about issues, we think about them in these age silos, and we don't really think about the ways that we've segregated individuals. Whereas if you're out and about, the way that people oftentimes think about things is family. It's a family. There's a grandparent, there's an aunt, there's a child. And when you think about that family, then you think about the interactions you have and that you want to have. It makes it a little bit clearer because no grandparent wants to visit their grandchild and pass an illness on to them, and no child wants to visit the grandparent, the nana, the whoever that they adore, and pass on an illness to them. So that interdependent and family lens, I think, makes a real difference. The other is I think it's respectful of elders and a role that elders can play in terms of educating younger people, younger families, first-time parents, about what they have seen in their lifetime, and with a number of issues. That role that we need to embrace of being the elders and being able to pass on history, culture, what we've learned is really important.
Absolutely. Karen, this question is for you. The project has such an impressive list of partners. I think it was over 175 right now. And I'm curious how you engaged all of those organizations, and how can our listeners perhaps do that locally to engage different organizations in a combined effort? Karen, you might be on mute.
Sorry, I didn't want to deal with Donna with my sneezing. We had a common interest. The community, the organizations, and the partnerships that we were able to come on board to be a part of our coalition all shared the same interests in terms of moving towards a goal of reopening our society and for our families to be able to gather and come together. I mean, it's not rocket science that the pandemic, shut us down and took us away from our familiar settings of being with people as social persons. And so no matter the business, whether it's in the business community, or whether it was a social organization, or whether it was healthcare workers, firefighters, I mean, you name all of them who have joined our coalition, we all had a shared sense of really just humanity. We understand that this is a public health issue, and that it was important for us through our own individual organizations to be able to reach our different constituencies and to share as much information and to try to really give them vaccine confidence. So that's why we made sure that we followed the process in terms of the clinical trials, that we made sure that the gold standard was met in terms of the approval process for the vaccine. And now we're working very hard to make sure that it's accessible. Not having to navigate. I mean, not everybody has a Melanie. We have people who still are not able to navigate that appointment process. And so as a result of our varying partners who are located in certain communities, we're able, through churches and through civic organizations, and they're able then to set it up. And so we're taking the vaccine to them rather than them having to go to it. So I think that the reason we've been able to gather, and we're constantly adding on new members to this coalition, is everybody recognizes, the importance of that information getting out so that people do have a confidence and a trust, and they're hearing it from trusted voices.
Absolutely. Thank you. So Donna, this question is for you. There are some families perhaps that are divided in their opinion of whether to get the vaccine or not. It could cause some disagreement. And so we're just curious if you've had any thoughts around best strategies to use when there are those disagreements. Perhaps it's a caregiver who doesn't trust the vaccine, but you have an older person who does. And so just curious about strategies to help with those family disagreements.
Sure, Emily. But first, I do have to say, Karen, you may be sneezing, but I miss seeing your smiling face on the screen.
Hay fever season.
I understand the cherry blossoms are starting to come, and the pollen definitely is. There are a couple of things that I think about when I think about family discussions. One is that I would really encourage people to look at the discussion guide that we created, because sometimes it's easier to have a conversation or start a conversation where you're using, maybe you watch the movie about Balto together, or you reminisce over Elvis Presley records and what is a younger person's favorite, or you find the common factors that are a little less threatening, and then can start to broach the conversation to a little bit more of a difficult point. But the other thing I think is that we've all seen throughout this is the trusted messenger, like who it is. Do they look like me? Do they sound like me? And so I think that clergy, that faith leaders have a huge role to play, and that if a family member can say, well, Melanie, your mother always goes to this church, and this is what the pastor is saying about vaccinations. Also the medical community, whether it's doctors, nurses, whoever we come into contact with, that oftentimes those are the trusted messengers that people listen to. So whether it's the language of that family, I think Melanie and I were talking once, and she talked about the importance of her uncles being able to talk to her mother because they knew each other, they trusted each other, whereas they might not have listened or talked to someone else. So I think conversations, having the guides, starting with something that's not as threatening and working your way to it oftentimes is helpful.
Absolutely. Let's stay on the idea of trust. And Karen, I wonder if you're finding through the project, what are the strategies that are working to address the issue of historical mistrust or just trust in the process, and strategies that are maybe not as effective that you're finding within the research and the project?
Well, I think a lot of people were just like me. Early on, last April or May, there's no way I was going to take this vaccine. I come from a community that has a long history of medical experimentation and mistrust and a lack of quality access to quality health care. So, the mistrust, the lack of not wanting to take this vaccine, it should be understood, and we try to make them, that's been our effort through this project that I'm involved with. But I think where we're seeing now is that that's one of the things we're very happy about our Count Me In campaign, is that people get an opportunity to go online and to tell their story on whether they're going to take the vaccine or whether they have taken the vaccine. They can show their photograph of them taking the vaccine. I've put mine on there. I did go and get the vaccine, because once I got the information, and once I heard from trusted voices and people that I look to for information on just about everything, I mean, from education to politics, there are people that just have an influence. And so we've been able to work with those groups, and we're still reaching a lot of those different groups, particularly in rural areas. It's a focus for us. But the hesitancy, it's still there with some people, but I tell you what, there are more and more people who are calling our office and asking us where, how, when, and why can't I get it? And those are the questions, not, I don't know if I still want to take this or not. So I think we are addressing the issue through all of the work that community organizations are doing in reaching their own constituencies, again, their trusted voices. And I think we're getting the message across that this is something that we're doing not just for yourself, not just for your family, but for the public good.
Yeah, thank you. We do have a question that came in, and this could be for anyone. Do you think the age categories for the vaccination rounds have negatively impacted the ability to get families vaccinated? So have to be 60 or over, or different age groups. And how do you recommend addressing that challenge?
Well, I'll just say that I think what happened is the initial rollout of the vaccine was very confusing because every state could do whatever they wanted to do. Then every state, every county could do, and then every city could do. So people didn't know what to do. They didn't know if they had to be 60, if they had to be 65, if they had to be a healthcare worker. I mean, so it was very, very confusing. I think now that since we did, of course, focus on the older population first, and of course healthcare workers and what have you, that we've been able then to have a great impact on getting seniors involved in getting the vaccination. I think that has been tremendous because other seniors saying they got vaccinated and people see they're fine and didn't grow an eye over here or what, whatever their fear may have been, that influenced other seniors. And so I think we were very impactful by allowing this population that was disproportionately affected by the virus to get it. So now that we're opening up the availability, there's more access. I think we'll be more young people then will be able to take it. We've all been young, and when we were Melanie's age, our mortality was not something that we thought about. But I think that with the senior influence, with grandparents telling their grandchildren that we really want to see you, but you got to be vaccinated just like I'm vaccinated, with other young people that are involved and understand the importance of vaccine, I think we'll begin to see an increase. And we're just so glad that the access has improved in terms of reaching people where they are rather than them having to navigate the system that was set up originally.
Thank you. Let's stay on access because I know that's a big challenge, certainly. And so, how can funders get involved in those efforts around access? If you had $10,000 to improve a point within that access challenge, what would you recommend?
Donna, you want to do it or you want me?
I'll start, and then Melanie, I'd like to know what you think about my answer. I think one of the greatest things that some funders could do would be to develop youth-led small grant programs around vaccine access. I think that a program like Melanie's been involved with is a great example, and we know about others where young people have really taken creative ways of making sure that they get the most older adults signed up because they're the fastest on their computer, or they do this or they do that, or they find ways. We're working with a project in Michigan, for example, right now that the college students are interviewing and getting information out to older homebound seniors and developing those into podcasts. But they're developing these ways of communicating and making sure that the older adults are getting vaccinated. And I think oftentimes funders, we all get in these silos, and when we think about a funder who's focused on aging programs, they sometimes don't think about the fact that, well, we could do a program that would engage a younger generation, and not only would it help us with the issue we're facing right now, but it would inspire more interest in the future of aging careers in a number of different areas. So that's one. I've got some other thoughts too, but I thought from the youth-led perspective, Melanie, I don't know if you have any thoughts about that, if you think that your friends or other young people would be interested in something like that.
I have a few friends that I think might be interested in that. I think the only thing would be a kind of intimidation aspect of having a youth-led stuff, because usually branches or like programs are led by the adults, so having the youth being leaders, that can be a little intimidating, or like just to have someone be there as some sort of guidance, and once those experiences have been given to like youth and people my age, then let them take more charge of that program or branch and have them figure out how they want to lead it.
I totally agree with you. I think the partnership between adults and in particular older adults and young people is important. We just oftentimes don't realize the power and the potential of young people as the leaders, and especially when they're connected and supported by older adults. So those are, some of the thoughts, Emily. I think one of the things that we're hearing about so much is access. So vans taking vaccines into communities that don't have easy access. That's something that funders can support, and they can get materials out through their grantees in various ways, whether it's because they deliver meals and they can include vaccine information, or it's a friendly visit program. There are a number of ways that they can get resources into the hands of people who need them.
Mm-hmm. Absolutely.
One of the
Karen,
things I've been encouraging some of these drug stores and pharmaceutical stores to do a 24-hour open. I mean, it's not like they would have to invest in that for a long period of time. So we've been encouraging them. Everybody can't get to a vaccination site that may open at 8 o'clock and stop at 5 o'clock. And so therefore you're missing a population of people who want to be vaccinated but aren't able to either get tested or get the vaccine. But I think we ought to use this opportunity also, and I would encourage our grant makers to look at how we can help change some of the perception of aging, that it is a process, that when you think of aging, it's not just old people, but that it is, if you're blessed with the long life, it starts at birth and then it progresses. That's something that we try to do at NCBA, is we're not waiting until you get old and sick and poor. We're trying to make sure that we're reaching younger people to tell them these are some things that you can do to change your aging process, by eating healthy, by dieting, by exercising, by working on your finances, what have you, so that as they age, they have that information. And we use our seniors to try to tell them, hey, look, you want to make sure you do this or what have you, so you don't end up like me. Now, they may not always listen, but we at least give them as much information as possible, so their aging process, once they get to be older, will be much more dignified and much more of a healthier experience for them. We've got to reach people younger, but we've got to change people thinking that when you say aging, you're just talking about older people. We're talking about all of us living a long and healthy and prosperous life.
Mm-hmm. Mm-hmm. Very well said. Thank you, Karen. I think we have time for just a couple more questions. This one came in from the audience. And is there any messaging or efforts created to address concerns of Latinx communities that are perhaps afraid to get vaccines because you may have to pre-register, there may be police present? Is that an effort that either of you or the three of you are thinking about? And how to address the fear within that community?
Oh, you're talking about with the immigration status?
Yes.
Oh, I see. Mm-hmm. Well, I know that we have organizations, Latinx, Hispanic organizations that are working very closely to try to get that information out. Our materials with our COVID-19 vaccination education and equity project also are in Spanish language, and we are certainly trying to reach as many people to try to change their view of that fear. And I know we've been successful in some ways, but I know that that's a real issue. And as I said, we're trying to reach everybody who has any hesitancy. And so I know that our Hispanic partners, Latinx partners, are working very diligently to get that message across.
That's great.
Melanie, I think in your program that's something that you've addressed. I know you were talking about some of your mother's conversations and some of your conversations. Anything in particular that you want to let people know about?
So while we were announcing when we would be signing people up, we made sure to announce that you didn't need any legal documents or insurance or driver's license in order to sign up, just because we knew that would probably be something that a lot of people in the Hispanic community would be worried about. So we cleared that up as best as we could while announcing it. And then when people went in to fill out forms, like health forms, so that the health workers could make sure that if they had any reactions, they could address it properly, we made sure to try and tell them that the sections that included stuff like insurance or driver's license, they didn't need to fill it out because it wasn't necessary. We tried to take it out of the first forms that we did, but for a different round, that was still included. So we tried to tell as many people that showed up that you don't need to fill this out, you don't need to have anything, you just need to fill out like your name, your age, the check boxes if you have any allergies, stuff like that, and you're good to go. You don't need any legal documents or anything, and no one's gonna check for anything.
Thank you, Melanie. Thank you for that. Well, we are getting to the end of our hour, and so I just want to thank each of you for being with us. And I want to close by asking each of you to share some final words to leave our audience with things to think about, final reflections. So Karen, I think we'll start with you.
Well, thank you very much for having me, and I have enjoyed the conversation very much. I just want to encourage everybody to please visit the website, COVID Vaccine Education Project.org if you want to get more information about our coalition. And also, please join our Count Me In campaign, where we want everyone to tell their story, why they decided to take the vaccine, and even download your photograph if you want to have a national, be a part of our national network. We know that when people see other people like themselves, that it makes all the difference in convincing people that this is a safe vaccine. So thank you very much.
Thank you, Karen. Donna.
Like Karen, I want to say thank you very much for this opportunity. I think that there are a couple of things that we have all learned, sometimes in very painful ways during this pandemic, and that's the whole issue of isolation. And oftentimes we think about hearing that older adults are isolated, they're alone, that they have been trapped during this time. But we also need to realize that the other group that reports the same thing are young adults that are feeling isolated, feeling alone. So that's why, one of the reasons why, even as we look at when we're building back better, when we're coming out of what we've been in the midst of, that intergenerational solutions and the ways that we can connect and engage people is so important, whether it's tackling a pandemic or tackling any issue in a community. But I think that there's been a lot of awareness that's been raised. The other is in multi-generational families, because multi-generational families are also on the increase in our country. And most of the media coverage has been more on the negative, on the, it's so hard for people to live together during a pandemic, where in fact the families are incredibly strong. And we at Generations United are releasing a new report where we surveyed multi-generational families during this time. We're releasing it next week. What we found has helped and hindered families during this time. So I'd encourage people to look at that, as well as our Bandage of Honor website, where all of our vaccine materials are. And again, just when we think about healthy intergenerational communities and families, to realize and remember that we are stronger together, and we're stronger when we think about solutions that engage and support us throughout our life course. So thank you.
Thank you, Donna. And Melanie.
I just wanted to say thank you for letting me come onto the webinar and talk about the stuff that I've been doing with San Cayetano. And I just wanted to say to try and encourage your family members to get vaccinated and to just keep each other safe, because this is a really big thing. And if you could get vaccinated and if you could just continue to try your best to keep everyone around you safe, that would be the best thing you could do for the community.
Thank you. Thanks, Melanie. Well, I want to thank Karen Jones, Donna Butts, and Melanie Valadez for being with us today and for the incredible work each of you are doing. I also want to thank Generations United and the American Federation for Aging Research for partnering on this new series with Grantmakers in Aging, and to the John A. Hartford Foundation for their support. I hope that you can join us for our next webinar in the series, which will be on April 8th, called The Science Behind COVID-19 Vaccines, Establishing Clinical Foundations and Addressing Common Misconceptions. We will be making today's presentation available to anyone who wishes to view it. Watch for an email to be sent within a few days. And finally, I want to thank each of you for participating in today's webinar. We hope you will join us again. Take care.